Got horse questions? We've got answers for you on Holistic Horseworks Live.
Why does my horse keep coming up lame?
Why don't these hooves ever stay even?
Why does my horse bite when being saddled?
My horse has been on injections, chiropractic, and acupuncture for years. Why isn't anything working?
Every show, we work with real horse owners on their real horse problems. Watch as we identify what's really going on with these horses, and you'll walk away knowing exactly what to do with your horse. Join us for Holistic Horseworks Live on the first Wednesday of every month at 1 p.m. Pacific, 4 p.m. Eastern. Register now. It's free to attend. HolisticHorseworks.com/live.
Hi, Joni. You want to unmute? There we go.
Hello.
Hi. So thank you so much for being here and being vulnerable and open about sharing issues with your horse so that we can make him more better.
Absolutely. This is Ralph. He's maybe a little impatient. He's been standing here for a little bit. He is a 9-year-old quarter horse gelding, and he is actually my mom's horse. And she uses him mostly for pleasure riding, but she does compete in like Western pleasure events, more of a ranch pleasure, I guess you would say. He doesn't, we don't ask him to go as slow as they do for the Western now. So more of a ranchy style pleasure, and mostly walk trot. Mom's not super confident yet, so she doesn't do a ton of loping on him. He's had most of the winter off, and he'd also, when it was snowy and icy, he got a swollen tendon this winter. So we were doctoring that. And the vet said he was good to go back to work. However, he just had a lot of soreness. And I had actually stumbled across one of April's videos on YouTube. I'm always trying to learn new stuff. And so I was looking up different podcasts to listen to and came across one of her videos. And of course, that took me down a whole nother rabbit hole. So now I am starting the level 1 course, and then I'm doing 2 and 3 with Lynn here in a few weeks. And yeah, so I did the distance reading that came with the level 1 course on Ralph with April. And she found several things that, aligned perfectly with what I'm learning in her course. But also she noticed that he pulled for some like viral bacterial stuff, and had asked if he had ever been tested for EPM. And we had been having some behavior issues with him being really grouchy, bitey, which is not like him, spooky. And he'd also started dunking his hay in his water bucket, which also was absolutely not in his normal routine. So when she said that, I actually took him to a vet that specializes in that, and they verified that he did, that he was positive for that. So he's been treated, and now we're really diving into all the holistic stuff and everything we're learning for April so we can get him to be as good as he can be.
And this is my home study program that is $400. It comes with a landing page with many videos on it because I'm a visual learner. For left brain people, it comes with a 150-page workbook with pictures and diagrams for left brain. So because I'm right brain intuitive, have to see stuff. And then short videos, and that is downloadable to your device. So you can take it out to the barn and you get a free distance reading. So she sent me in pictures of her horse, and I have to say, like a medical intuitive for horses and people, what bones are out, where there's pain, bacterial and viral issues, where they are. Is it in the head? I think he had it in the head, right?
Yes.
Bacterial in head. So a lot of horses, the head shaking, the rubbing, cranial compression from past pullback when tied can fracture teeth. The dental tools, the heat and the friction can crack teeth. You can have cavities. You can have bacterial sinus infection. And we have a really easy mash recipe with dynamite trace minerals that clears all that up. People say, "Oh, my horse stopped tossing its head and dropping and rubbing it on his leg," which is really nice. And when I get viral affecting blood, muscles, and brain, then it's inside the spinal column. And if it's bacterial and viral, that's when I'll suggest to my clients to test for Lyme. If it's just viral, I suggest that they test for EPM. And I did give you a protocol, but what did you do when you got that report?
Well, I went through and I started ordering all of the dynamite products that he needed for that. So we could start doing the hoof soaks, and then the minerals and the release spray because he had some cranial things going on as well. He had first rib.
No, I mean, when you got my report to test for viral, what did you do?
Oh, yes. That's when I scheduled an appointment. There's a vet just north of us that's an EPM specialist. Like that's mostly what he works with. And that's when I took him there and they verified that that is what was going on. So they did a whole treatment on him.
And so they tubed him with something and then his disposition changed how?
Yeah. So, and it was pretty crazy. It was within like 24 hours of the treatment. They do a 2-part treatments, 2 weeks apart. But yeah, they tube it through their nose down into their stomach. And then they also do an IV treatment. And then he gets high doses of vitamins, B vitamins specifically, and anti-inflammatories. But yeah, within 24 hours, I mean, because he had some front end lameness going on as well, but it was intermittent. It just didn't seem to make sense. One day he was fine, one day he wasn't. And yeah, all of it just completely cleared up. He was back to his lovey self, not spooky anymore, just calm, like where before the treatment, he wouldn't have even been standing here. He would have been bouncing back and forth and bitey and yeah, all of it went away after we treated.
That's amazing. People don't realize that horses can have issues where they're just not feeling good. And what I find is when there's viral and bacterial, one or the other or both inside the blood, it's in the dural tube. And the dural tube is inside the spine. It goes from the sacrum. It's your separate blood supply that goes up to the head and comes back down. And if that's out of balance or being attacked, you can have gait motor functions, So a lot of these things that are being diagnosed, we've helped horses with kissing spine and string halt and wobbler syndrome. You need to look at the whole horse, not just treating one area. And so she got the distance reading, which is like an 8-page report from me where I go through the horse. It takes a couple of days, release the atlas on the left, first rib, both sides, elbows, withers. And you've done a bunch of that work already, right?
Yes. And there was either 14 or 15 trapped emotions he was dealing with as well. And so when I started doing the emotional release for that, it was really neat to sit and watch. And my mom was out here too. And so it was cool because he was just, staying there. Obviously, I'm barely touching him, but he would have these huge reactions for each emotion release. I mean, just huge yawns and lick and chews and gas releases. And yeah, it was an obvious release for him. And it just seems like that's one of my favorite things I'm learning through this program, because not only does that help us, our animals, every animal and our horses, but it is really neat to see the disposition in them change off of releasing those trapped emotions for them.
And a lot of that they actually get from the owners. So make sure you read the book, Dr. Bradley Nelson, Trapped Emotions.
Yep, I did read that one.
Good, because you still have 67 to release.
Yes.
Yes. So now in the level 1 course, we go through the structure and the skeleton. Level 2, we go through fascia, organs, bacterial, and viral. When you're looking at that emotion code chart, look to the left. There's sister meridian organs. Then you can use your yes, no for which organ is it affecting. So like grief is lungs, and a lot of the horses that have cancer in the colon will find colon issues through the emotions. Horses internalize emotions, and, being a therapeutic horse, those horses are taking on all of those, the veterans and the handicapped children. So all of the horses really need this program. And it just, my ex-endurance horse, Tiki, I got him off the racetrack when he was 8 and spent all this time with him. And now my friend has him and he's going to turn 31 this year. And she still takes him out and lightly rides him. He had a really hard first 8 years. And then with me, he did 2,000 miles of endurance in 2 years with no vet pulls. I took all of these courses to keep him sound. And then people are like, oh, we got to work on other horses too. Okay. And people are like, wow, my horse just flies through 50 miles in 4.5 hours with straight A's now, because now you have 100% of your horse. So don't wait for joint injections and everything. We need to do preventative if you want them to last through the 30s. So, are you okay if we go straight to the PowerPoint now?
Yeah, are you ready?
Joni?
We have a couple of questions if you want to answer them before we pop over there.
Well, pop that up and then we'll answer questions while people read the.
Okay, I'll get it ready.
Is there a holistic way to treat what? I'm trying to see that. I can't scroll up for some reason.
EPM.
So
The question
for
is about
people
EPM.
asking about the EPM, so I'm not allowed to say that I diagnose it. I can just say I find viral affecting all these things. I had given her a whole protocol of things to do that would have cost about $250 and taken some time, but it was really, to me, fun to see that she went and got the diagnosis and got the treatment and saw the difference in 24 hours. So knowing that her horse picked up that virus sometimes in the water supply or the hay supply from possum poop or bird poop, we're having a lot of issues when I do distance readings now that viral's coming up in the water the horse is drinking from the birds pooping and landing on it and drinking from it. So, and what's in the water. So I'm recommending water filters on Amazon that you put on a hose, like for a motor home or RV, to at least filter some of the water going in and to be cleaning it more often if you see birds at your water trough. So in future, what Joni might be doing is my preventative to make sure it doesn't come back after this treatment, which was the detox of zeolites, which is an antiviral in the mouth. Hot oil spine treatment with certain oils that I had sent to her. I have a video on YouTube about that. We mix it up with the carrier oil. We put it down the spine and then we do a hot, wet towel and a blanket over that. And we cook them for like 10 minutes. And you can see their whole disposition change. Horses that don't want to be touched, don't want their hind end to be touched, moving away. They just, and you do that about every 3 or 4 days and they just change. But do not put horses back out in the sun if you put oils on their coat because it can blister them. So, any other questions that I missed?
There's one in the Q&A. I'm not sure if you have that pulled up. It's pretty much the same question. Specify the treatment protocol used for EPM. I have not heard of a 2-day protocol and what was tubed. I think they maybe have a question about what Joni experienced specifically.
Yeah, we're not going to get into that right now, though.
Okay.
Okay. I'll have Joni email that to me, and anybody that's interested in that, I still prefer my way, that is not having the tube a horse and trying that first. So my email is april@HolisticHorseWorks.com if you have more questions about that. So Joni's horse, Ralph, was a performance horse. Didn't he do reining or something when he was younger?
Nope. He was more into like the true Western pleasure when we bought him. And then we transitioned him more into like a ranch pleasure because he just doesn't move in the way that they want those pleasure horses to do. And I felt like it was going to hurt him the way they were showing him. So we just transitioned him into a little bit more of a natural gait.
Okay, so looking at the front hooves, you guys can read the screen. So I always tell people to squat down and look at your horse's hooves, and mainly from the rear. So the farrier trimmer can cut and shape the front, but when you look at them from the rear, you're going to see how the body's loading. Does anybody have any questions about these pictures and the arrows? Your coronary band should be round. It should not have anything hard under it when you're pushing all the way around. Those are the acupressure ting points. Everything in the front feet is for digesting nutrition, power, wind, and regulating body temperature. Heart, lung, large intestine, small intestine, triple heater, and pericardium. Pericardium is the sac around the heart. So if your front hooves are out of balance, none of those organs are in balance. And on the picture on the right, you can see the imbalance in the hooves, and he has pads. He shouldn't need pads. Why does he have pads on, Joni?
He normally doesn't. He only had pads on because he had hurt his tendon prior, and it was because the snow was balling up in his feet. So they put a pad on there to try to prevent the snow from sticking.
Yeah, I've had those kind of issues before. I have an amazing hoof soak recipe. You have to put it in like a UC Davis soaker boot, and I do have YouTube videos on how to do the soak. You can use old IV bags as well. We use a dynamite liquid trace minerals and a cup of Epsom salt in warm water, and you stand the horse in it for 45 minutes. And it toughens the sole. It kills the white line fungus, and you can actually go from shod to barefoot. We do the soak 3 days before, and you can do it with shoes and pads on. It acts like an ionic foot bath that people would go to, and it pulls all the toxins out of the hoof and all the bacteria and abscesses. So on this horse, if he was mine, that's where I would start. And then she's going to, she already has some oils. She's going to sign up with doTERRA with me so she gets the free miracle spray recipe. And the miracle spray recipe, you put it on your hands and you do 360 degrees around the coronary band on all 4 feet. And that helps balance all the ting points and the meridians. The hind feet is all about processing and eliminating toxins, liver, kidneys, stomach, spleen, gallbladder, bladder. So you want to always do all 4 feet, especially on competition horses. So if this was my horse, I would soak his feet 3 days in a row and help the hoof to be more comfortable. Her doing the body work is going to get him standing more square on the feet. If the horse is standing in your cross ties or tied to the horse trailer and they're not square, that shows you that there's issues higher up in the body. If the front feet aren't side by side, it's in ribs and withers. And if the hind feet aren't side by side with the hoof crocking, then your pelvis is out. No body work is going to hold when the horse is standing on feet like this on the right. That's like you standing on a high heel and a barefoot slipper. There's nothing in the ribs and withers, which is why my program teaches you how to check your horse every day. And as you keep the body in alignment, then they start standing square and the hooves start standing where they should be so that they can grow down. The base of the hoof where it touches the ground should be wider than where it comes out of the coronary band. Anywhere that it's not, that's where they're jamming and loading first. Any questions on this before we go to the next slide? Okay, next slide. I can't see all the questions, Lisa, so you'll have to read them out if you see them.
Okay, there's none right now.
My thing's not scrolling up. So hind end, you'll see a lot of, I can go to barrel racing and reining events and you see this huge butt and the hind feet are so close together on a 4 and 5-year-old horse. And I can walk up and say, so are you injecting those hocks yet? And they're like, yes, how did you know? Because the hoof and the hock should be in alignment with the hip. It shouldn't be more narrow. And what causes that is the psoas attachment behind the saddle on the 17th and 18th rib where it starts. The other end of that attachment is inside the hock. So the tighter the lower back gets, the closer your hocks are going to be coming together. And you shouldn't see all of these clumpy, lumpy muscles. People are like, oh, look at how muscled, it's hind in it. That's like Arnold Schwarzenegger. You're not going to have any athletic stretch and ability. Healthy muscle should be soft. So that's toxins and lactic acid buildup in his hind end on the picture on the left. And he would not be able to bring the knee, the stifle, up and forward well and use the hocks well. So he's going to be coming more from his lower back to pick up his hind end. Any questions about this?
We don't have anything right now.
Okay. My chat's not scrolling. Next one. We actually have 3 things to go over today. Another one is a horse that roars and gray horses, melanoma, and cancers. Okay, so this was him before he got treated. And you can see him in the cross ties. He doesn't look like this anymore. Right, Joni? He's
I don't know
looking
if you can
sleeker
see.
with all the body work and the detox, and you're doing the bladder meridian sweeps, right?
Yes. Yep.
The bladder meridian sweeps just opens and tonifies all his organs. So, you know, he kind of looks like little fat pockets all over in the hind end, and you can kind of see how he's tucked up under, which would kind of tell me about digestive issues. When you start seeing fat pockets on the hind end and up under the mane, that crusty neck, then your horse has definitely got a lot of toxins, and that's why we do the detoxing. And we'll show you some products for that at the end of the presentation. Most of them you can get on Amazon, so I'm always just trying to find, you know, products easily available for my clients. Any questions about this? Okay. My theory on metabolic issues is it all starts from cranial compression as a whole.
Somebody asked, what is the difference where it looks similar to Cushing's?
So I'm not allowed to say that he looks pre-Cushing. But to me, the metabolic issues in Cushing starts from the cranial compression that we're going to show you on some head slides. All the horses that I've worked on have past severe pullback trauma as a foal. The knotted rope halters are doing so much damage to the horses. We're seeing more Cushing, more uveitis, more head shaking issues, more dental needing issues of teeth needing floated because young horses are started in the knotted rope halters that don't have any give. And we'll have some slides on that later in this presentation. So I've worked on a lot of horses that were diagnosed and on Pergolide, and we did my level 1, 2, and 3 on them. Level 3, we manually moved the cranial bones. I developed it. So most cranial classes is just energy work. We actually move and pull them. And if you look at your horse, I don't know if you can see my picture. If you come up to the very, very top up here, this should feel like 2 goat horns growing out under his forelock in between the ears. We'll show you some pictures later on in this presentation. And the horses that have the metabolic issues, the occiput and the parietal are smushed down into their head, and that compresses the hypothalamus and stresses the pituitary. So then you have the sugar overloading and the toxins. You can also look up under the glands on your horse in here and see if they're big and hard and swollen as well. My horse used to get this in California when the acorns were dropping. And then I'd have to go get a whole nother bottle of detox and give it to him in a week just to pull out the toxins from the acorns. So yes, we do a replay on this that you guys get, anyone that signed up for this. It takes Lisa a while to process it, put it all together and everything. It doesn't usually come out till like Friday or Saturday. But yes, anybody that got here late, you get the whole presentation. Okay, and make sure you stay to the end, because the end is going to be, you're going to have about 1.5 minutes of, you know, scan this, do this, whatever. But the end is when you can open up and ask any questions about your horse. So don't, you know, cut off as soon as you see the little advertisements. Next screen. Like I said, this is why we're hosting them on Vimeo and not YouTube, so I don't get kicked off my own channel. So this is talking about his head. So, and you guys, if you get a regular halter and you get out there and you take a picture, look to see if one nostril's lower, one cheekbone's lower, one eye looks lower, more pushed out. When I was traveling and people would say, let's go horseback riding. I'm like, oh, I can't ride that crooked horse. I just can't. I can't look at the ears, you know, start looking at the ears when you're on your horse. Is one more close to the middle and look tighter. These are all the things that we teach in level 2 and level 3. We actually rebalance the whole horse's head. So you also shouldn't have up-down chew muscles on their forehead, because when they're chewing up and down instead of grinding sideways, that's what's creating the hooks and waves that needs the equine dental floating. So when you do my I think it's $650 for a level 3 in-person class, everything changes. The equine dentist says, wow, I only need to touch up one tooth instead of power tools. Your horse is grinding their food better. You're not seeing pieces in their manure. The digestive issues and the gas seems to go away. So if you look at these arrows, most people are like, I look at my horse's head every day and I didn't see any of this. To me, it looks like his left eye is lower. Does he seem a little bit heavier on the left rein, Joni, when you guys ride him?
Trying to think which, yeah, it would be. Like he has
We
troubles
actually-
going.
Sorry?
I said like when I work him, I lope him. My mom doesn't. And he definitely it would be heavier on the left when he's loping right. Like if he's in his right lead, like he's going to pull on your left rein.
Right. I mean, some of that can be in feet because we looked at the balance of his feet. But if you're just checking rein, so I tell people to get a tape measure when they're bitted up, go from the middle of the pole down to each side and see if you have one more wrinkle on one side. You'll be like, wow, one side's actually a half inch lower. When the horse sits down and pulls back, they usually lean to one side if they can't get away, and all those cranial bones shift. So people think that when I talk about cranial bones, I've even, had Western medical professionals say it's just one big bone. No, it's not. There are 26 different sutures that all come together like a jigsaw piece puzzle. And every head trauma that horse takes 3 to 4 years later, you're going to see a whole bunch of issues. And it could be the first time the foal is haltered at 2 months old and it's rearing up and you don't want it to fall over backwards on a, pile of boards or something. All that pressure on that skull when it's so young does so much damage, vision issues, uveitis, teeth issues, needing dental floating. So there's a lot of stuff happening to our horses in the past 25 years that we didn't used to have when we used the flat web halters with the cheap snaps and the horse pulled and it broke and they ran away. There was less damage to the horse. So now that we have the knotted rope halters and the patient pulls, we have more cranial issues, more metabolic issues, all kinds of issues in the horse's head because of that. Any questions about this screen? So his right nostril is higher, right? So his left one, which is our right side picture, that's why I asked if he's heavier on left rein. When they pull back, that whole TMJ is actually dropped and there's less of a gap. So even if you use the Masterson method on working on the TMJ and the masseters, you actually need to pull up the top of the jaw joint. Okay, so in my level 3 class, we actually pulled this up, giving that gap back. If the horse can't chew across sideways, you're going to have hooks and waves, and you're going to have a horse heavier in one rein. And if you fix the head, all the resistance goes away in the horse, and they get to keep their teeth through their 30s instead of you having to go out with mash buckets because your horse has no teeth.
That does line up for Ralph as well. I mean, the left nostril does always want to flare up higher, which I'm not that far in the course yet to know how to fix it, but I'm working on it. But for the dentist, when they come, they have him on a 6-month schedule because of hooks and waves, and it's all on that side.
Yeah. So when the jaw can't go sideways, they have to chew up and down. It'll be locked. And the problem with the dental tools is, I don't know if you can see this picture.
Mm-hmm.
You got to get in here. Okay. The dental file is flat. This is not flat. So when they get in there with big power tools, right, they're taking these teeth down too short and leaving the front and back ones too long. Your equine dentist, it's a whole nother $25,000 in schooling, does individual teeth. You should not have someone in there with power tools doing this. The vibration, the heat, and the friction cracks teeth, and it also loosens it in the gum. So my whole program is, I have horses competing in their 20s that are doing as good as when they were 12 because we're maintaining them. We're giving them Dynamite Free and Easy joint supplement before they need it because a performance horse is doing more miles on those joints. Okay, so once you do level 3, you're gonna head to Indiana and take Lynn's class.
Yes, I think it's in 2 weeks.
Yeah. So Joni bought the $400 home study level 1, and then she's jumping over to my instructor Lynn in Indiana, who's a level 4 Pirelli person as well. But and she's going to be doing just a quick refresher on level 1 and make sure she's doing all the moves right. And then 2 and 3. And level 2 is all about the fascia, the organs, the bacterial and viral issues. And level 3, we're actually moving and shifting all of this. And then she's going to come back and fix her horse. And then the equine dentist or vet's going to say, wow, we don't need to like do this huge power float anymore. Horse only has that much tooth. It's growing up and you keep filing it off and pretty soon you're not going to have anything left. Someone asked if they can do dental without power tools. That's when you want to look for an equine dentist. And unfortunately, the vets don't like them. So the equine dentists are tiptoeing around like I am under the radar. So you can post on horse groups on Facebook. Does anybody know about an equine dentist coming to this area? Please private message me because they can't say it out loud. They're not supposed to be sedating horses without a vet, etc. My equine dentist in California, I had followed him around watching him do horses. And there's a trick. If you can see this skull, there's a groove here on your horse, and you'll see this hole right there. That's where the knotted rope halter sit, but that's where the nerve ganglia comes out. I don't know if everybody can see it really good, but so the knotted rope halters is right on the bundle of nerves. And he would just stroke down this groove for 5 minutes. The horse would just settle. This is what I do with horses that aren't wanting to be worked on for body work and just really stressed, and just keep stroking down through that. And the horses would just open up their mouth and he would do individual teeth without any power tools. And he had a whole book on each tooth means something. And in our people wellness one that we did in March, the clients having recommendations to have teeth removed for deep bacterial infections that was causing all the other health issues in her body. So when I do your distance reading and I say there's bacterial in the head or sinus or having to do with teeth and stuff, because you got that too, Joni, that there's a couple teeth bothering your horse.
Mm-hmm.
And the vet can look in there and say, I don't see anything. That doesn't mean that you don't have tooth pain. Go to the dentist and they say, no, nothing works. And like, yeah, but my tooth still hurts. And that's our horses. They don't want to take a bit. They're having a bad day. It hurts when they eat. So, the whole horse matters. And so just ask in your community about equine dentists. And they usually come every 6 months. You really want to get away from the vets and the power tools. So vets usually in school have 8 hours of schooling on teeth, and that's cats, dogs, horses, and everything. So you don't want them learning on the road. You want them learning about each tooth and what each tooth means in the horse. Okay, next slide. I hope you guys don't mind. This is going to turn into a really long webinar because we got 2 more horses. So this is how the cranial compression, this skull on the right, my friend had picked up. She actually knew the horse and he had always spooked on the right. He was a big time spooker. So this top bone is what I talk about, the parietal and the occiput. That's what the halter catches on. So the cartoon on the left is what a horse looks like when it's pulling back when tied. And that halter slides up and catches on that bone and shoves it down and forward. And if a horse can't get away, you've seen them where they just totally lean to the left side. And that's when all the bones drop on one side. A lot of horses have more than one head trauma. So we have to figure out what sutures are stuck and we free them up and we pull it back up. That could have been uveitis on the skull on the right, on the right eye. You can see by the line that eye is shifted out and down. Yes. So horses, I've worked on horses in their 20s and 30s. It's, we put a lot of release spray on the head, and the technique that I developed when I was in the UK teaching is just amazing. We pull everything back up. It's more calcified if they're on high calcium water, if they're on alfalfa. It might take more than one session because they're really stuck. Because I don't know if you guys can see this skull pretty good. This was actually a casting of a real horse skull. And if you see skulls, they're supposed to have all these cracks. You know, that is your sutures. So they jam. And whenever you have a jamming of something, you have heat, you hit your head or something, or you have a concussion. Well, the body sends calcium to heat to lock it down. So we have to break up the calcifications. But yes, we do pull it back up. My dearest friend that has my retired endurance horse, Tiki, I met her because I was following this equine dentist around, and to see if I liked what he did to refer him to my clients. And I went to her house, and 20 feet away, I looked at her horse. I go, "Oh, your horse's head is way crooked. I bet he did a lot of pullbacks." And she's like, "Yeah, we can't tie him." And he was, I think, 25 or 26 at the time. His name was Speedy. So they still couldn't tie him. So we did the body work and we did the head work. And at the time, the equine dentist would only charge her 50 or 75 to touch up a tooth. And the next time he came, her bill was like 175. And she asked why it was so much, because we had shifted all these bones and now he was chewing. He's like, "Well, now I can balance the whole mouth." The whole way of how he's chewing has changed. It changes how the teeth erupt. It changes everything. So he could actually balance better and chew better. And older horses that get the diarrhea, they can't handle the stems in the hay and stuff. It just really helps them out if everything can just be in there grinding and chewing really well. So yes, it's never too late to do something for your horse. Okay, next slide.
That's the end of this one.
Okay. Any questions specifically about what we went over, Joni and her horse, in this presentation before we move on?
We did have a question from someone. What can I do if there's no one in my area to have my horses done without power tools?
Well, I had already answered that. You have to get on the Facebook groups because they're all under the radar. There's no yellow pages for them. You need to ask Barnes privately and quietly, do you know of any equine dentists that travel to this area? Okay.
Yep. That's all the
Thank you,
questions we
Joni. Do you have anything to say?
Thank you. Thank you, guys. I was glad to be a part of it with Ralph.
Yeah, so Lynn is my instructor in Indiana. She's doing East Coast and the middle, and then I'm just doing teaching on the West Coast. If anybody wants to host a clinic, the classes are only 6 people, so it's really intense, hands-on. And Joni, what did you think about all the information in my course? Is it a little bit overwhelming because there's so much?
There's a lot. Like it's a lot of information. You get more than your money's worth. That's for sure. Like, I mean, it's not anything you can't understand. Like it's attainable. It's just a lot of information. It's way more than I would have thought I was going to get.
Yeah, so many people just break things down. You're like, really? That's what I got for $300? Massage 6 muscles. And I'm like, here, how much can you absorb? And
Yeah.
people ask if there's a time limit on my courses. I get women that say, "Oh, my kids are finally grown. I'm coming back to your course. Can I still do it?" And I'm like, yeah, it's never ending.
Yeah, I'm excited for it. I'm really excited to do my hands-on stuff too, to like fine tune and make sure that what I'm doing is correct as well for the level 1. So
Yeah. So remember, so I don't just sell something. So when you buy my level 1 program, you get a free distance reading on your horse to tell you what's going on with your horse today. And you get to submit 5 case studies to me, one at a time, where you go out and work on another horse. So my program It was like, what did I not like about the classes I took? Well, once you paid for it, you were on your own. You didn't get any support. So, and you didn't get a way to go get clients. So I say, go into a barn, say, I have to do a case study where I take pictures and I document what I do. And my instructor is going to look it over. Is there a horse in this barn that could use a free session? That's maybe not, getting firsts and seconds. You always want it to be on a riding horse, that some little kid in 4-H or something. And then they notice the difference. And you submit that to me. There's a case study example on your study page. And then I tell you what you missed. Like you missed the elbow or you missed ribs 10 and 11. And if by the 5th one you're still doing it, then we zoom to see how you're doing the move. So you get all that support. Your horse is going to block you on what he needs. So you always learn more doing someone else's horse. Cool. Well, thanks for being on my show. We're going to pop over to Ruth now.
Thank you.
Thank you. He looks so much better than those first pictures. Can we get a back? Can you kind of go back so we can see the whole horse again? Remember all the fat pockets and everything in the other picture? His coat looks better. He's looking smoother, so he's starting to detox a little bit. And he's starting to stand more square, isn't he?
I'm sorry, Joni, I muted you.
That's my fault.
But he's starting to stand wider too, which I love because he was standing really tight in the hind. And his prior owners, when we bought him, said he required yearly Hock injections. So as I learned that through your course, I was like, oh, that makes sense. Because now he can actually stand with a wider stance instead of so far underneath himself and tight.
Yeah, that was the pictures that we had shown with the arrows, and he was just so bunched up like this. Cool.
Yeah.
Okay. Anything in the mouth or sinuses, if a tooth has been pulled or a tooth has been cracked, dynamite liquid trace minerals works as it's the only thing we put in wounds, and it closes things up. I've had people that needed a root canal put it in the tooth, so we put 3 full dropperfuls of that in wet mash that's like oatmeal, so they're going around the mouth like this, and then it's actually going up in the gums and up through into the sinuses and working on anything, cavities and abscesses in the horse's mouth. We can't really do the cross ties. We really got to move on to 2 more PowerPoints. But she will be back on the show after she does level 1, 2, and 3 on him with Lynn in probably 2 months. And we'll see the new Ralph.
Thank you for joining us for Holistic Horseworks Live. We hope you'll join us for the next show scheduled for the first Wednesday of every month at 1 p.m. Pacific, 4 p.m. Eastern. Now we have some amazing horse care resources for you. First up, our Free Horse 101 ebook. Everything you wish you had known before you got your first horse, and many aha moments for experienced horse owners. Available at horseacademy101.com. Next, to get 24/7 horse care help, right in your pocket, download the Holistic Horseworks Remedies app. Available on Google Play and the App Store. You'll have access to comprehensive guides and solutions for a wide range of equine health challenges, right there at the barn, on the trail, or whenever you need it most. Want to learn how to read horses just like April? Check out this #1 bestseller in horse care on Amazon, What I See When I See a Horse, a book about learning to see beyond the surface of a horse. This book will forever change how you perceive and care for horses. And if you're ready to dive deeper, we've got 2 paths for you. Holistic Horseworks online courses let you learn how to help your horse yourself at home. And they include bonus offers like a free equine distance reading and a 30-minute consultation with April Love, very much like what you just saw today. Or, if you want the best Holistic Horseworks experience, join us at one of our hands-on clinics. We have clinics all over the world where you'll get real hands-on experience with real horses. And finally, here's a special offer just for joining us today. Use coupon code LIVE75, LIVE75, to get $75 off our Level 1 Equine Musculoskeletal Unwinding online course. Visit HolisticHorseWorks.com to redeem this offer. If you want an even bigger offer, make sure you join us for the next Holistic Horseworks Live, where we share even bigger discounts just for our guests. It's on the first Wednesday of every month at 1 p.m. Pacific, 4 p.m. Eastern. Register for free at HolisticHorseWorks.com/live.